Hello and welcome. I'll be speaking to you about meningitis. It's an infective condition, and it's really quite important for us to have some very basic information about meningitis. The brain is surrounded by protective membranes referred to as meninges. These are pia, arachnoid, and the dura mater. They protect the brain. If for some reason these protective membrane becomes infected, then the patient is said to have developed a condition called meningitis. So infection of the meninges is referred to as meningitis. So what causes meningitis? There are a number of infections that can cause meningitis. This could be viral, bacterial, fungal, and tuberculosis. The presentation is really important. How do you recognize a patient that has meningitis? I'll mention the triad of meningitis, 3 cardinal presentations. Number 1, fever. Number 2, neck stiffness. Number 3, headache. If you know somebody that has fever, headache, neck stiffness, these 3, the triad, constitute the cardinal features of meningitis. There are other things that could present. Number 1, patient could have seizures when it becomes really very severe. They could lose consciousness. They could develop a rash. So other presentations could come up. They could have difficulty looking into bright light called photophobia. These are other presentations that could occur. But the triad I need you to remember: fever, headache, and neck stiffness. Meningitis can affect virtually anyone, but there are people that are predisposed, so to speak, have a propensity to develop meningitis. This would be neonates, little bones, children, and then it could also occur in young adults and the elderly. There are a number of factors that could predispose patients to develop meningitis. Number 1, if there is an immunosuppressed state or immunocompromised state, for example, patients that have diabetes, retroviral disease, that's HIV. If there is anything that suppresses the immunity, you're predisposed to developing infections. It's also important to mention that such patients should be mindful of being in close contact with people that have infection. And of course, it's important to mention that close proximity or proximity to patients that have this condition, in other words, become a close contact, can become a problem with regards to developing meningitis. How do you prevent meningitis? Number 1, avoid close contact with those infections. Number 2, if you have had close contact, then you have to present in the hospital where you'll be given antibiotics for prophylaxis. Prophylaxis simply means preventing the occurrence of the condition. And then, number 3, there are vaccines that are available to prevent certain types of meningitis. It's important to also get vaccinated if that becomes necessary. And so, in this video, I've mentioned number 1, the triad of meningitis: fever, headache, and neck stiffness. It's important that you get treated as soon as possible because this condition can deteriorate quite rapidly. And then it's also important to mention complications that could occur if treatment doesn't occur on time. This could include hearing loss, could also include recurrent seizures or epilepsy. If you've learned something, like, subscribe, and share. Thank you.